Me through the pine straw there.
Sorry.
Well, good morning, everyone. I'm gonna start over here. All right, well, good morning, everyone. First of all, let me thank you all for being here this morning. I want to thank everybody for hosting us this morning and hope everybody had a safe, happy holiday weekend. I also want to thank Dr. Toomey and Commissioner Berry for joining us today, and certainly the whole team here at Pruitt Health for hosting this press conference. Also, just wanted to recognize Senator Butch Miller and Representative Matt Dubnick. Certainly appreciate their strong leadership here in the Hall County area, and just two great friends of mine, and really appreciate all the support that they have given us through this public health state of emergency. I think a lot of people take for granted that that's never been done before that I know of in the state. Took legislative action, and I think those actions have certainly been warranted, but I want to thank those guys for their continued strong support. 2 weeks ago, we watched hope arrive here in the state of Georgia as the COVID-19 vaccine began rolling out throughout the Peach State, and since then we've been vaccinating the vaccinators in every corner of our state as frontline healthcare heroes in hospitals and public health facilities rolled up their sleeves for the initial doses of both the Pfizer and Moderna vaccines. I also want to again thank President Trump, the Trump administration, Operation Warp Speed, all of those individuals in the public sector and private sector who have made this vaccine possible. I don't think people really realize the medical miracle that we are experiencing right now, so I want to again thank them. Today we also begin another exciting and important chapter in the administration of COVID-19 vaccine here in Georgia. Across the country, no group has been hit harder by the virus than the residents and staff of our long-term care facilities. And for months, we have used the full weight of state government with support from our federal partners to ensure that these facilities had the resources necessary to fight COVID-19 head-on. Our Georgia National Guardsmen served as a model for the rest of the country. I know that seems like a long time ago when that started, but it is amazing what they did, completing thousands of infection control missions in literally every community in Georgia to ensure that these care centers met strict guidelines to help keep the virus at bay. The men and women of the Georgia State Patrol made urgent deliveries of critical supplies to keep residents and staff healthy. And to meet the increased need for testing, the state has spent now $78 million in coronavirus relief funds to support COVID-19 testing in nursing homes throughout our state. These measures have been the result of an unprecedented partnership between the federal government, local leaders, and our partners in the private sector. And today we're proud to be here in Gainesville as the next step of that partnership gets underway here in Georgia. As another testament to the strength of the public-private partnership in fighting COVID-19, the federal government and the team at Operation Warp Speed have rolled out a program for long-term care facilities to partner directly with CVS and Walgreens to deliver the vaccine to their residents and staff. Dr. Toomey and Commissioner Berry can speak more to the specifics, but I can tell you that more than 95% of our facilities across the Peach State have already enrolled in this program. And we are eager to see the vaccine make its way quickly and safely to our most vulnerable and to those great Georgians who are giving them world-class care. Right here at this facility, Pruitt Health is already lining up its caregivers to receive the vaccine. Among them is Jonathan Harris, a senior certified nurse assistant for Pruitt. He was selected to be the very first Pruitt healthcare giver vaccinated in Georgia. Jonathan, we're excited for you and for all of your nursing home staff today. I want to thank you for your willingness to step up and be number one. It says a lot about your commitment to your patients and to your profession. Staff, as you know, in our long-term care facilities have been the frontline heroes for months now, and we could not be more grateful for their work and for leading by example of getting the vaccine. I've also been told that to celebrate their caregivers, Pruitt Health is joining with Waffle House, another great Georgia company, to buy all vaccinated Pruitt Health staff breakfast. Whatever it takes to get them to take the vaccine. Each frontline worker who is vaccinated will receive a Waffle House gift card, and if that doesn't get you in line, I don't know what will. In a moment, I'm going to turn it over to Dr. Toomey and Commissioner Berry to give more details on where we are on the distribution of the vaccine. But first, I want to ensure all Georgians that we are working diligently to get the vaccine out and following the direction from CDC. In the meantime, though, we still need every Georgian to do their part to stop the spread of the virus as we face the new year and the rest of the winter season. Though the news of the vaccine is encouraging, right down the street at Northeast Georgia Health System, they are seeing the highest COVID patient volumes yet, and the largest number of patients in any hospital anywhere in our state. Last week, their message was loud and clear, and I'm here to echo it once again. COVID-19 is still here, and it still presents a threat to the people of our great state. On the state side, we continue to work around the clock to stand up the temporary facility at the Georgia World Congress Center. That facility should start accepting patients by the end of this week and will be a big help to alleviate pressure on our area hospitals and statewide hospitals, and ensure that they have the capacity to continue caring for their patients. And as I mentioned last week, by December the 30th, we will have an 80-day supply of all critical PPE supplies ready to deploy at a moment's notice. That said, we know the best way to mitigate the spread of the virus is through our own personal actions. Over the last 30 days, the highest percentage of new cases has come from individuals that are between 18 and 29 years of age. And while death in this category are thankfully very low, these individuals can bring the virus home with them during the holidays to their parents, grandparents, and others who are more vulnerable. That is why, with New Year's Eve this Thursday, I'm again making the same plea I made last week to the people of our state. Limit your gatherings to small groups of people within the same household. Consider gathering virtually to watch the ball drop. Consider the risks of including elderly loved ones or those more susceptible to the virus, and implement the best practices and public health guidance outlined in our orders into your plans. As I've said several times in recent weeks, the guidance in our executive order has been the same for months now, including limits on bar capacity and gatherings over 50 people, and can be enforced by any state or local law enforcement agency. And I know that they do not want to have to do that. So I'm encouraging everyone to help be part of the solution, not part of the problem. And I would ask all Georgians to take that into consideration as we look to the New Year's Eve and New Year in just a few days. We also need people to continue to follow the 4 things that we've been talking about to limit the spread of the virus, regardless of your New Year's plans. Wear your mask, wash your hands, practice social distancing, and continue to follow the guidance in our public health executive orders. While we wait for the vaccine to be available to the general public, which we do not anticipate for a few months, we can all do our part to slow the spread by making wise decisions and acting in the best interest of your fellow Georgians. Together we can ensure that Georgia continues to weather this storm and emerges stronger, safer, and healthier than ever before. Thank you so much for being here, and with that, I'm going to turn it over to Dr. Toomey to make some remarks to you.